just ahead on Pathways.
You're sitting on the couch in their living room, you see their family photos and you get to ask, and they're always offering you things and happy that you're there. It's really rewarding. A lot of them see it as a visit. You become a part of their routine, which I think is really special.
Most people think of nurses in hospitals, but there are several nursing careers that take you outside those walls.
Hello, listeners, and thanks again for joining us on Pathways, part of our Healthy, Happy, and Wise podcast series at Northern Light Health. I'm your host, Emily Tadlock. Today, we are taking nursing to the home. We're headed out of the traditional hospital where we've been for the past 2 episodes, and we're exploring something a little bit different. And we're going to be talking about what home care nurses do. So here to take us through her day-to-day is Jessica Muzzy, a nurse with Northern Light Home Care and Hospice.
That's right. Yeah.
All right. Awesome.
Hey.
So thanks for being on.
Yeah,
and
you're welcome.
taking some time out of your schedule.
Sure.
So first of all, tell me a little bit about you, Jess. What made you decide to become a nurse?
Yeah, so I come from a medical family. My mom is a nurse, and my dad is in the healthcare profession as well. He works locally at Eastern Maine. So it's sort of, always kind of been a conversation at our household. I actually initially went to school for music therapy. So that kind of, helped me blossom kind of to figure out that I did love to be in healthcare and that I wanted to go to nursing school. So I did that. I started on Grant 4 over at Eastern Maine Medical Center and did some cardiac nursing initially and then had a family. So I had my first daughter and was pretty much looking for a schedule change initially.
Okay.
So that is kind of why I was branching out and had considered home care. And that was almost 9 years ago, so
you went
have
for a
been here to
schedule
stay.
change
Yep.
and decided to stay.
Yep, definitely. Yep. It's definitely for me. I worked per diem for a number of years and, now I'm in a full-time role. So
Okay.
yeah, it's been really rewarding. It's been a great shift.
Okay. So you were in a traditional hospital setting
Yep.
and now you're not. What are
Yeah.
some of the similarities and some of the differences between
Sure.
working in a traditional hospital and then working for home care?
Yeah, it's pretty similar. I mean, you use all of the, normal components of nursing, what we learned in school, and utilizing your assessment skills, performing a huge variety of skills in the home. I would say even sometimes more so than I really saw on the floor and at the hospital.
Oh, okay.
So, it's patient-facing, patient-directed type care, which I think is, really feeds the heart of a lot of nurses.
Absolutely.
And with that said, you're with one person at a time. It's a nice change of pace. I think, the difference is that you have a caseload, and you have a certain amount of patients that you're seeing that day. But when you're with them, you're with them, So I think the interruptions, as far as what occurs during your visit and during your assessment really varies, and differs from that at the hospital. But otherwise, it's the same. You're caring for patients and providing a lot of education and doing what we love as nurses.
Okay. So, but your day-to-day does look different.
Mm-hmm.
So can you take us through what a typical day for you looks like?
Sure. So you would start in the morning and look at your schedule. So that can potentially be from home, which I think is really nice, really appealing. Or you might find yourself heading into the office to get certain supplies, but you're assigned a certain amount of visits that day. Variety of visits could just be regular routines, those patients that we've had on service that we're providing a particular skill for, or potentially this is their first visit, so we're doing an admission, or they've been at the hospital and we're resuming their care. So the number of patients that you see per day will vary depending on the visit type and what we're there for, but you log into your computer, you kind of see who you're seeing that day and what your plan is. You're triaging, I think similar to what you would potentially do in the hospital, figuring out if you have a time to visit or if there's somebody that you need to see first. And then you're calling them and setting up your day and hitting the road. So,
okay.
Yeah.
So one of the differences maybe would be in a traditional hospital, you have other nurses that are nearby, you have managers nearby, you have other professionals within the hospital nearby that you can run to and tap on the shoulder and say, I need help.
Yeah.
I think that's something that could be scary
Yeah.
for some people when they think about home care nursing.
Yeah.
What would you say to to those fears?
Yeah, it can feel a little scary and intimidating in some ways because of exactly what you explained. I think that's a lot of nurses who make that transition will tell you that that's what they miss, is poking your head into the hallway and saying, hey, can you come look at this? Or, oh, help me,
Yeah.
So there is more autonomy, and that can be great. And then, you are relying a lot on your own assessment skills, which also is, I think, really huge, and a great learning opportunity for people. You may be physically there alone. I mean, sometimes we do joint visits. There are situations where we bring another nurse with us, just depending on, a learning opportunity or something, or maybe you're doing a joint visit with another therapist.
Okay.
So tag teaming does happen sometimes, but otherwise, when you are alone, you're there, but, technology really has kind of connected us in some great ways. Your manager or another nurse or a lead nurse or provider's office, or just on the other line. And another example of that is if we're there for wound care or we're not quite sure if something is healing like it should, or we're not really sure as far as a recommendation to make, we can take a photo, upload it, do remote consult with our wound nurses. So, there's ways to utilize your team.
So you're alone, but you're not alone. It sounds kind of funny to say it that way, but yes, you're alone physically in the home,
sure.
but you're still connected to an entire, and I heard you say this several times, team.
Yep, definitely.
It takes a team to do the type of work that you guys do.
Yeah, you have others involved, on your care team. You might have a patient who only has nursing in, but many of our patients that we see have a multidisciplinary approach, so physical therapy, occupational therapy, social work might be involved.
Okay.
Other nurses, LPNs that are on your team, home health aides, so it's definitely able to consult with others, to provide that type of case management approach.
Okay.
Yeah.
Well, teamwork is always, I think it's a common theme that I've heard so far. We're only on episode 3 of our series for this season, but I hear the word team every single time. And I think that's true no matter what specialty in nursing you're in.
Yeah.
You talked about this a little bit. You started in the hospital. You decided to switch to home care because of the scheduling. At one point, did you know this is where I want to be? I mean, you're still here 9 years later. So was there a point where it was just like, this is it. This is where I want to be. I don't want to go back to what I was doing before.
Yeah, I think it's the relationships, with the team that we talked about, but then with your patients and their families. We have, I think, more of a unique opportunity to see somebody, their certification period, the amount of time that we're in with them will vary. Sometimes it's really short. We're there for a really acute amount of time while they recover from a specific surgery. Other times we're there long term, providing education, caring for somebody's chronic illness, managing some chronic disease progression. And you get to know them.
Yeah.
You see them week after week. They're grateful. You can kind of slow down a little bit and think about their care from a greater approach, not just trying to solve something quickly and then with discharge from the hospital in mind. So I did start to feel like nursing was noble again. I think, when I was in home care for probably maybe a year or two in, where I kind of was like, yeah, this is really fueling that passion that I had and why I became a nurse initially. You can get tied up when you're running crazy on the floors, shelling out meds, call bells left and right, being pulled in and out of rooms. And it can be hard to feel like what you're doing makes a difference. And I think I have found that again in home care. So that's really what has kept me.
Okay. Well, and one of the things, so we just, again, mentioned some of the differences that you've felt personally from going from that traditional hospital setting to home care. But we've also gone from a hospital into someone's literal home. And you say you get to know people really well. What is it like walking into someone's home So I don't know if any of our listeners know this, but I used to be a reporter.
Yep.
And, when you'd have to go to someone's home, knock on the door to ask them if you could interview them, that was always so nerve-wracking to me.
Yeah.
That's one of the scariest parts of my job. But at least, your folks know you're
That
coming.
we're coming. Yeah. We're not cold calling them or
Right.
anything. Yeah.
Exactly. But what is it like walking up into that person's home and really kind of becoming part of their world?
Yeah, you're on their turf for sure. It helps, I think, to understand them a lot more. We definitely see ourselves in some pretty unique situations for sure. I mean, the way that people live, huge variety of the lifestyle. It can get a little dicey sometimes, just as far as you could imagine.
Oh, yeah.
Right? I mean, but I think it allows us to understand really where they're coming from and relate to them on a more personal level. And I think it just, for me at least, it changes my behavior. You're in their home, you're a guest in their home, you're there for a particular skill, a particular task, but
I think, I just recently I was able to go with you in like a little ride along for a video piece that we're working on to kind of explain what home care nurses do.
Yeah.
And I think one of my favorite parts was when the lovely lady that you were visiting, the lovely patient, she was so delightful and wanted to talk to you all about our family.
Clamming?
And you knew all of their names. You knew all of them.
yes.
And it was just like, oh, what?
Yeah. Well, it's fun. I mean, right. You're sitting on the couch in their living room, you see their family photos and you get to ask, and they're always offering you things and happy that you're there. You see their animals and their pets. And so, it's really rewarding. A lot of them see it as a visit and they look forward to it too. You become a part of their routine, which I think is really special. Yeah. But you do. Yeah, you get to know them and their hobbies. Yep. You ask how things have gone, and it's really great.
I remember her talking about her shopping trip with one of her friends, and it just seemed so natural. And she really did seem happy to have you there. And it was more than just having a nurse visit. It was just like having a friend come by.
Yeah, right. Totally. There's follow-up, as far as more than just their medical stuff. You ask about things that occurred the week before and how their grandkids are. And so, I think that they value that as well, just as much as I do.
Do you feel like that gives you insight to make take a more holistic approach to their care? I mean, you can see if they've been eating, if they have food, if, their living situation is one way or another, is it conducive to them healing and getting better?
Yeah.
Does it help with that?
Yeah, you get a glimpse into their support system too. What type of help they have. You get to know, I think, more establishing that relationship. You get to know their goals a little bit better. They start to open up to you and really kind of figure out what do they value? What is important to them? And that can help tailor their care plan for sure. Okay. And I think they're receptive to that when we realize that we're there to help, when they realize that we're there to help them.
Yeah. And your goal is recovery.
Yeah. Yep. The goals will vary, but essentially that's the hope, is that we see some improvement, and we're working towards a discharge with them. So we are, an acute short-term service that's helping with the transition of them being in the hospital to now being home, or having had a new diagnosis or something that we're educating them on. But that is the hope, is that we meet goals and do a discharge, and that they're stronger for it.
I think that's important to point out because your name, a lot of times, of the organization is Northern Light Home Care and Hospice. And I think a lot of times you guys get kind of grouped together. Not that you don't work together, obviously.
Sure.
But,
we help each other out.
But you get grouped together, and really it's two different types of nursing. And, while you may still be using a lot of the same skills and things like that, it's still two different types. And so I think it's important that we talk about that separation, that difference.
Yeah,
even though you're
totally.
under the same organization.
Yeah, the approach is different. Yeah, it looks the same in a lot of ways as far as us caring for them in the home. But with home care, you're right. I mean, the goal is for discharge, for improvement. And with hospice, it's the approach of improving quality of life, symptom management for those with a terminal prognosis. So.
Yeah, and next week we're actually speaking with one of your colleagues, Allie Rohr, who is a hospice nurse for Northern Light Home Care and Hospice in Ellsworth.
Yeah.
So she's going to explain a little bit about what that's like being a hospice nurse. So for those of you listening and are interested in that, make sure you tune in next week for that episode. Yeah. But really, just, it sounds like home care is a really personal experience. Mm-hmm. And maybe it's not for everyone, but it could be.
It could be, yeah. And those who are interested, we totally encourage to come hang out, do a ride-along day.
Okay,
Just kind of see what it's all about. I think for the most part, people are pleasantly surprised with the types of environments that we're entering in and the connections that we make and the skill that we provide. It's fun stuff. I mean, I was beyond surprised with the amount of tasks and skill that we can provide in the home. Wound care, IV lab draws, central line care, ostomies, a lot of education. So it's fun. You're definitely not losing your skills when you come to home care. So,
well, that's good to know, because I think some people think home care is for those nurses who have been working as nurses their entire lives and they're getting ready they want something slower paced and they want to get out of the traditional hospital and do something but that's not really the case. I mean, you guys have a new grad program that's new and it's flourishing.
Yeah. A residency program.
So talk a little bit about that.
Sure. So it's for new nursing grads, and it's a year-long residency program where you're paired up with a preceptor and oversight from a clinical lead. And it's great. I mean, we encourage new grads to come and really work on their assessment skills and their education skills and in the home care setting. So it's definitely something that we're excited about. I think it is growing and expanding. And you're right, it used to be you graduate from nursing school and you go do your time on the floors. You go do your night shift or you're, schlepping around and doing those 12-hour shifts. But that's not really the case anymore. We have opportunity to be here and to learn and educate those new nurses in this type of setting.
Another common word that's used, opportunity.
There's
there's so many opportunities for people who have a nursing degree. There's so many different avenues to take, and now we've explored this one, going outside of the hospital and heading into someone's home.
Keeping them home. Playing a part in helping them stay home and stay strong and independent. So that
and for
really
so
rewarding.
many of us, independence it's so important.
Yeah.
Well, Jess, I can't even say how much I appreciate you.
Yeah,
you're
being
welcome. On this podcast with me, and I hope that people have a better understanding now of what home care looks like. And thanks to our listeners for joining in as well. We spoke about it earlier on the episode, but in 2 weeks, we'll come back out with a new episode, this one focusing on hospice nursing. We head to Ellsworth and speak with Allie Rohr. And trust me, you're not going to want to miss her amazing story. So make sure you tune in again to Pathways in 2 weeks.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.